Welcome to this month's episode of the PA Path. I'm Emma Sellers, Chief Recruitment and Engagement Officer at the PA Education Association. This episode is sponsored by AmBoss. I'm delighted to have Dr. Lucy Kibe and her AmKeny Medical Camp Program team on the podcast. Dr. Lucy Kibe is a respected healthcare leader, educator, and researcher with over 20 years of experience spanning clinical practice, academic leadership, research, and public health. As associate professor and physician assistant program director at Charles R. Drew University of Medicine and Science, she mentors future PAs from aspiring applicants to practicing clinicians. Dr. Kibe founded the AmKeny Medical Camp Program with Dr. Wilson M. Ha. AmKeny is a nonprofit organization that bridges passionate individuals from the United States and Kenya to bring health, education, and hope to underserved communities. In February 2026, 4 physician assistants and 2 pre-physician assistant students participated in a medical mission in Kenya, providing care to thousands of patients while gaining valuable experience in global and community-based healthcare. Dr. Kibe, it's great to have you and your team on the podcast. Before we get started to the meat of everything, I would love to hear a little bit about each person. So I'm going to start with Dr. Lucy Kibe, who is one of the co-founders of AmKeny, who's going to tell us a little bit about herself and how long she's been volunteering with the organization.
Hi, so I am a PA educator and primary care PA. I graduated from Drexel University, and I have only ever worked in federally qualified health centers since I graduated because of my love and desire to support patients who are underserved and marginalized. And now I work at Charles Drew University of Medicine and Science, which is exactly our mission, which is to eliminate health disparities. And so here in the US and across the world, that is my life mission. And so co-founding AmKeny is one of the greatest things that I think I've done in my life, which supports with PAs in Kenya. Kenya is one of the countries that also has PAs called clinical officers and works together with them, bringing together PAs from the US and other healthcare providers from the US to Kenya to partner to make a difference in people's lives by providing healthcare and other services.
Thank you so much, Lucy. And next we'll go with Miriam Ha. Can you tell us a little bit about yourself as well?
Hi, good morning. I'm a PA. I've been in practice since 2007. I started off in primary care. Like Dr. Kibe, I've been working with underserved communities for the entirety of my career. I've also worked in corrections for the past 15 years, retired from the state, and currently working with LAPD jail clinics.
Awesome. Thank you so very much. And next we'll go to Ajana.
Hi, my name's Ajana Williams. I am a recent graduate from Tuskegee University, where I earned my degree in health sciences and a minor in psychology. A big part of my journey has been combining clinical exposure with real world experience. So in February, I had the opportunity to participate in this medical mission trip, which I think really helped deepen my passion to serve these underserved communities, as well as reinforce why I chose this path. I work as a medical assistant and an EKG technician. So my primary role does include being the first person patients see. However, this opportunity would just allow me to explore patient care beyond what I do in America.
Awesome. Thank you. Always exciting when we have students able to take advantage of these wonderful opportunities as well. Next, Gaelen, can you tell us a little bit about yourself?
Yes, my name is Gaelen Waar. I'm from Carson, California. I graduated from UCLA with a degree in biology in 2020. And since then, I've been working as an ophthalmic technician at South Coast Retina Center. And I joined AmKeny as a volunteer last October. And since then, I've really enjoyed the opportunity to explore my interest in global health and my interest in serving underserved communities across the globe and working with a lot of really great people and great PAs.
Great. I can't wait to hear more about it. Thank you so much for being able to join us today. So, next up, we have a husband wife duo, which I think is going to be very interesting and bring some good color to our conversation as well. Mr. and Mrs. Akinloye, can you talk a little bit about your experience and tell us a little bit about yourself and your background?
My name is Laye Akinloye. I am a physician associate, certified, Emeritus. I am a alumni of Charles R. Drew PA program, Medics 18, graduated 1984. Initially, I practiced as a general surgical / trauma PA under Dr. Fleming at King Drew Medical Center for 5 years. During that 5 years, I co-founded and directed the PA postgraduate program for PAs in general surgery and trauma. In 1991, went to Cedars-Sinai Medical Center as a cardiothoracic surgical PA. I founded the cardiothoracic surgical PA postgraduate program. I've retired now. It'll be 4 years, June 1st.
Awesome. Thank you so much.
My name is Alabi Akinloye. I'm a retired physician assistant. I've been retired for 4 years now. As a PA, I worked across a number of disciplines. I started out in pediatrics and then went in interventional cardiology. Then I went into liver transplant, general and trauma surgery, and then into occupational medicine. And that's part of the beauty of being a PA is you can work across a number of different disciplines. When Dr. Kibe presented this opportunity to do this medical mission in Kenya, we were excited, and it turned out to be a very worthwhile and fulfilling endeavor. It was more than I could have asked for. It was a lot of hard work, but hard work is good for you.
Awesome. Hard work is good for you. I love that. Thank you so much, everyone, for sharing and telling us a little bit about you. Again, very clear. There's no shortage of expertise who travel to do this work, and we look forward to learning more about it today. Lucy, can you tell us, particularly from your role as a co-founder, tell us a little bit more about Kenny, how it got started, the motivation behind this program, and how you go about bringing together this group of individuals and what the whole group looks like once you get there.
Yeah, so one thing that is really special about AmKeny is that it was actually started by PA students. When I was a student at Drexel, a group of us classmates came together and we decided that we were going to spend our Christmas break doing some good work. And that was all the way back in 2011. So a group of PA students from Drexel, we packed up our bags and we went to Kenya. We partnered with the local organizations who planned the mission trip for us. And we were able to treat a lot of patients while we were there and practice our skills that we had been learning. And so when we came back, we decided that we saw the need. And so we decided that we were going to start a nonprofit and do this again and again and expand it so that we would be able to offer more support to the people of Kenya. One of the things that was really important to us was partnership. Kenny, we just don't go to Kenya to do the work for them. The idea is that we partner with clinicians and other healthcare providers on the ground, and we share expertise, and we support the local community in several ways. The word Kenny, the name AmKeny actually came from, it's AmKeny, AM for America, and KENY for Kenya without the A. And the word Kenny sounds like the word in Swahili for arise. So the idea is to have partners in America and partners in Kenya arise, come together, and do some work. A couple of things that we do. Healthcare is at the center of what we do. And so we support communities by providing healthcare when we go to do these medical missions. And we've been able to help thousands of patients who otherwise would not get the care. The second thing we do is that we help with the education. High school education in Kenya is not free. even public high school education. And so we support some high school students by paying their tuition. And we've had students who are now in university because of the support that AmKeny has been able to provide. We also support the local community in many different ways. There's a group of women called Deborah Ladies who are marginalized and really underserved. And so they're part of a Christian ministry that come together, and we support their local food bank. So once a month, they come and get groceries that are given by people who have donated to AmKeny. And then the partnerships where we provide training, we exchange ideas. We've been able to send medical books to PA programs in Kenya. The programs in Kenya are called, PAs in Kenya are called clinical officers, but it's really the same profession. And so we are able to work with the clinical officer schools and clinical officers in the field by providing some training, medical books. We've provided stethoscopes, iPads, and other resources that they need to use in their day-to-day work. So it is a partnership-based organization, and anybody can join in any of the activities that we do. Everyone is welcome to join in. And particularly this time, this was the first time we were able to take pre-PA students. And that's very special to have Ajana and Gaelen join us so they can learn more about not just medicine, but global medicine, and stretch their medical thinking, critical thinking beyond the walls of the US and see how other people in the world treat diseases. So that was very special for us. And the PAs who came with us, it was very special to have PAs. This is the great thing about PAs. We are resilient. If you bring a PA to a medical mission trip, the PA will be in the hall where they're treating a UTI and writing prescriptions. They can also go down the path where cervical cancer screening is happening, and they can do cervical cancer screening. And they can go down the hall where we're hanging IVs on trees and do some inpatient type care there. And they can do some minor surgery in the field. As bringing PAs to the mission field is really special because they can do everything and anything that is needed out there. So it was a very special time for us to be able to bring PAs and pre-PA students to this mission.
Lucy, absolutely. And the excitement when I hear about the dynamic work that PAs are able to do, and to your point, in any situation and do it well. And then the other thing that I'm so excited to hear you highlight is the first time you've been able to have pre-PA students come. And of course, that's such an awesome experience for all people involved in the PA world, but particularly our pre-PA students to understand just the no boundaries to what this profession can lead you to. Let's take a quick break for a word from our episode sponsor, AmBoss. AmBoss, the all-in-one resource for learning, teaching, and practicing medicine. PA educators nationwide trust AmBoss to streamline their teaching, aid in remediation, and provide an extra layer of support for their students. Educator tools such as assignments, including sequestered questions, powerful performance data, and AI-powered curriculum mapping, ensure an efficient, personalized experience tailored to your program's unique needs. Discover how AmBoss can empower your teaching at go.amboss.com/PA-EDU, or visit them in person at the AAPA conference, booth number 3720. We have several other things we're going to get to, but what I would love to hear from each of you, and we'll start with the students and then allow our PAs to just follow suit, to tell us a little bit about your role from the student perspective or the pre-PA student perspective, from the PA perspective, with this most recent experience, and how you were able to interact with the rest of the team, with other PAs and other medical professionals.
Yeah, so my role during the medical mission was to be a volunteer, and at least like where my little clinical experience lies is I work at a retina specialist. I'm a technician, and my job is basically to be like, we're the first person that the patients interact with when they come to the clinic. And basically my idea behind being able to join the medical mission was there's an eye clinic that was there, and I would be able to assist in vision screenings and be someone that can distribute reading glasses, and just be there to shadow the PAs and the Kenyan clinicians, and just be a sponge and just be excited to observe, ask all the right questions, learn as much as I can. And then as far as interacting with the Kenyan clinicians and other professionals out there, formal greetings was, I noticed that was very, very important when meeting everybody there. So you greet everybody with a firm handshake and say hello, introduce yourself, say your name, say your role and why you're there. And like we learn a couple like greetings in Swahili. So as tourists, we often greet people with the word jambo and as in hello. But funny story, probably like a week within my time there, or like at the end of the medical mission, one of the students that I was interacting with, I was going around saying jambo, jambo, jambo to everybody. And then one of the students looks at me, she's like, why are you saying jambo? You sound like a tourist. And I was just like, oh, that's funny. So she told me that if you're not a tourist, then most people will often say sasa as the greeting to each other. So I changed it up real quick so I could sound like I'm not so much of a tourist.
Oh, I love it. Those are things that a textbook is not going to teach you, but are extremely valuable and important. Awesome. Thank you so much. Ajana?
Yes, I'll hop in for sure. This was an amazing experience, especially as a pre-PA student. Given that I'm a medical assistant and an EKG technician also, the roles usually go hand in the office. But I will say, being at this medical mission, you could do everything. Like the flexibility of being a student. And I wouldn't say not having sole responsibility because everyone had a responsibility. However, we were able to run around and support patients, providers, clinicians, clinician officers in so many ways. It was like we were just accessible. We were standing next to the provider in whatever specialty it may have been, and we had about 3 minutes per patient because of how long the line was. I just was able to help with patient flow, assisting with vitals, assisting with the cultural competence because there were language barriers. So being able to really listen to the patient, look at them as humans. We are from America, they're from Kenya, but we all have one common ground, which is the fact that we're humans. And that was really powerful for me. Every symptom, every clinical sign will not be the same. And I think being in this medical mission trip, that really solidified that. Although I cannot understand you verbally, you can see the distress in patients' eyes. You can see the different cues that they're giving you, telling you what hurts and how you can help them. These patients had walked miles, and for some of them, this was the first time in their lives that they were gonna be receiving medical care. And so for me, that was such a true stamp because being a pre-PA student, the fact that I was able to make that impact as a student and be able to be a part of the care team of some patients that had never received medical care, it just made me think, wow, if I could serve 3,000 plus as a student, I can only imagine a lifetime.
Sounds incredibly enriching. We're all human. How powerful is that? And something that we can never forget that no matter where we are, where our feet land, we're all human. Laye, we'll start with you from the PA perspective. Can you tell us a little bit about your role and your experience, what it was like to interact with the other medical professionals there? And then again, we'll just ask the other PAs to follow after Laye.
Okay, my background is surgical. So this was a little bit of a stretch for me. I hadn't practiced primary care medicine per se, other than hypertension and maybe a little bit of diabetes. So I had to do a little homework and go back and read on some things. But once I got there, their language was Swahili. So I had an interpreter with me who was very patient and he was very knowledgeable. I think he was a third or fourth year medical student. My station was women and children. So that's where for the 4 days, seeing under 4,000 patients, a little under 4,000 patients. And most of them was women and children. And hypertension, the runny nose, the little menstrual pains and cramps and things like that.
Thank you.
Okay.
Yep.
So for me, this was my first time working outside of the U.S. practicing medicine, my first medical mission. And so we did decide to go, and I'm glad I did. And what I worked at, I did a lot of different things. I was assigned to the men's clinic, and the men's clinic usually ended a little earlier than the rest. So I would try to help out after that wherever I could. I worked in the eye clinic, go to the lab to see if there was anything I could do there. Actually, I spent one day, about almost most of the day in the lab doing AccuChecks and things like that. And what I found, one of the things we did was you're in this place where you have to do a lot of improvisation. We had a guy needed a paracentesis, which is a person that has a lot of fluid in their belly, and you have to stick a needle in there and let it drain out. But it comes out very slowly. But we didn't have a bag to catch it in. So we used the 32-ounce empty water bottles. We started out with a pan, and we would pour the fluid into the water bottles to measure how much we were getting off. And then I decided that it might be a better way to do it. We found a liter water bottle, put a hole in the top, stuck the tube in there and taped it down. And that worked. So you realize you have to just figure out things as you go.
I actually done missions and worked internationally. I've worked in China, Tibet, Central America, and these missions for me are always an exercise in exercising my ability to be flexible, my flexibility, my creativity, and definitely humility. Going into a space that is unfamiliar for me and beginning with my assignment, because I worked 13 years in an adult male prison. So everything men's health was my comfort zone, prostate exams. I did them every day, but I was assigned to pediatrics and I hadn't seen peds in years, working with women's health for years and definitely with a different culture and in many cases in a different language was a challenge for me. Like Alabi just said, you have to think out of the box with your approach to care. AJ said that we are all human, and at the end of the experience of working with your patients, you definitely see that. But there's a certain appreciation that I get from being able to sit with a clinical officer student or medical student who is educating me about their healthcare system and informing me where I can refer a patient who has had chronic back pain and some type of chronic condition that I haven't seen here in the States. And I think we all learned about jiggers, which was a very it was a very specific health condition, something new for me, and I was able to link up with the professionals in public health. And I've been doing this for almost 20 years now. And I think we know as medical professionals that we are all, and physician assistants, that we are always students. I get stretched every time I move internationally. There were certain things that were the same for all of us, and we were able to support each other with the goal of improving health outcome, which is what I think we all wanted to do. I enjoyed every moment of it.
Awesome. Thank you.
Emma, I want to just set the stage for our listeners when we say clinic, right? This medical camp, which is what they're called in Kenya, was happening in church grounds. They have their chapel, and then they have some halls, big rooms, and then they had a building that was under construction. And so we were utilizing all of those buildings. So with the large halls, because we needed different stations, we had to divide the hall using wires and bed sheets to create different spaces. And then in the building that was under construction, there was no windows, and that's where the cervical cancer screening was happening. And so we had to put bed sheets and create like little sort of rooms using bed sheets in there. So and then some of the work was being done out in tents. So this is a very outdoor type of just a makeshift hospital, if I may. We had the pharmacy, we had cervical cancer screening was one of our main things that we wanted to do because preventative care in Kenya is not very common. And there's actually, speaking of learning new things, cervical cancer screening in the field happens in a very different way in Kenya. So we actually had a lab, that's a makeshift lab, with reagents in Tupperware and a microscope. And we were able to do self-screening. Women could get the sample themselves, or they could just do regular screening. And then the sample was taken next door to the lab, the makeshift lab. And we were able to get results for HPV screening immediately. And then that information would go back and the patient would get treated. So here's a woman who walked miles, has never been screened for cervical cancer, gets screened, precancerous cells are seen, and they get their cryotherapy and they get treated and they go home treated. And we just saved a woman from having the cervical cancer in the future. We also had an eye clinic that Gaelen has mentioned. That was a huge area because we didn't realize that there was going to be that many people that needed eye care. So the lines there were really long. And we're talking about 1,000 people a day coming to this medical camp.
Wow.
And so the lines were really long there. And we had a volunteer that offered to do cataract surgeries for any patient that was diagnosed with cataracts. And so you had somebody come in who was almost going blind, was diagnosed with cataracts, was taken into the clinic a few miles out, got their cataract surgery done, and then brought back to the camp. That person came in almost blind and went home seeing. That's the power of what these sort of missions can do. We also had a Moore University College of Dentistry. They brought about 50 students, and they were able to do a lot of dental work there. About 154 extractions they did. In one day, they did cleanings, they did fillings. We also had counseling. So we had therapists that did counseling for patients. We had spiritual care, and anybody who wanted somebody to pray with them, there was some preaching going on. AmKeny is not a religious organization, but our partners, some of the partners that we worked with are. And so that was an optional service that we had. We had physical therapy, we had nutrition. And so we have all of these things going on at the same time. And so a patient will come in, they'll get registered in one of the tents, they'll go and get their vitals, they'll go and get their primary care service somewhere, and then they'll get referred either to the eye clinic, to cervical cancer screening, to prostate screening, to the dental clinic. And if they have an acute problem, they might go down to get IV. We were giving shots of different kinds. So it's a lot of things happening at the same time. And so it's a really busy makeshift hospital going on at the same time. And so the logistics are enormous. And so having people who really knew what to do or were willing to do what was asked of them was very important. And I also want to give a shout out to the Kenyan volunteers. We had about close to 250 Kenyan volunteers that came to help.
Wow.
Because again, we have about 1,000 people coming in every day. We had people who were helping out in the kitchen because we were feeding our volunteers. So we had a whole kitchen department. So you could be assigned to the kitchen as well. So it's a really big production.
Lucy, absolutely. And thank you so much for sharing all that detail. It really helps us visualize what took place. Because to your point, using the word clinic and some of these things, it didn't quite give exactly what you described. So thank you so much. I appreciate Dr. Kibe and her team for joining us, and thanks to everyone for listening. Learn more at amkeny.org. We will have more on the AmKeny Medical Program in our next episode. We want to give a big thanks again to our episode sponsor, Amboss. For more information, visit them at go.amboss.com/PA-EDU or visit them in person at the AAPA Conference booth number 3720. We will be back on the PA Path next month, speaking with leaders in our profession, both nationally and worldwide.